Yom. Today we will be talking about the reproductive system. Mainly, we will be focusing on the female reproductive system, as from the yogic point of view, it's important to understand the female reproductive system because most of the ancient yoga texts they do mention that women should not be practicing yoga during menstruation. So, to understand the concept behind this, first we need to know about the female reproductive system, and then probably we'll try to go into the reasoning why those ancient books they mentioned that women should not be practicing yoga. When I say yoga, it's yoga postures, yoga sun are not to be practiced during menstruation. So let us try to understand in short the basic parts, the basic organs of the female reproductive system. This is a cross section of the pelvic area where you can see the urinary bladder in front. Behind it is the uterus, and then behind it the rectum or the part of the digestive system. We will move on. We will move on to the next slide. Just a simplified sketch so that we understand it better and we understand it in a easy manner. So this is the sketch of the female reproductive system. The main part of it obviously is the uterus, the mother's womb. So it's more or less triangular in shape. And this uterus, or in simple language, as we call it as the mother's womb, where the baby grows for 9 months during pregnancy. The internal part of it, or the internal cells of this uterus, they are called as the endometrium. So this portion, what you see, is the endometrium or the innermost lining of the cells inside the uterus. Now this uterus is further connected with two tubes, one on the left side and one on the right side. And these tubes they are called as the fallopian tubes. So two of them, one on the left and one on the right side. And at the other end of the fallopian tube, there is one more organ which is called as the ovary. So again, there are two ovaries, one on the left side and one on the right side. So the fallopian tube, the other end of the fallopian tube is just close to these ovaries. Now the lower part of the uterus, it opens into the muscular portion called as the vagina. And this opening of the uterus in the vagina is called as the cervix. So this portion is the cervix, the opening of the uterus in the vagina. Now usually this cervix, it remains closed most of the time. On a few occasions it opens, like for example during menstruation, that the blood flows out of the uterus into the vagina, or it opens during ovulation so that the sperms from the vagina they can enter into the uterus, or it is also open during the process of childbirth so that the child, the baby, can come out of the uterus down into the vagina. So most of the times this cervix it remains closed, but then on a few occasions, as I mentioned, it remains open. Now this is in brief, in short, about the female reproductive system, the parts, the organs of the female reproductive system. Now let us try to understand briefly about the process of menstruation. Now, here I'm not going to complicate the thing by talking more about the hormones and how it is controlled by the brain or the hormones and the endocrine system. I will just explain the physical process so that later on we can try and understand about the yogic practices. So, the normal menstrual cycle actually it starts when the ovaries they start producing the ovum. So after puberty, when the ovum they are produced in the ovary, then the menstrual cycle it starts. So each month, or to be very precise, every 28 days, there is a production of one mature ovum in the ovary. Now, this ovum, just for simple understanding, we would say that it's the female egg. So, this ovum, one of it, it gets matured in the ovary, it grows up in the ovary, and then it bursts out of the ovary, or it comes out of the ovary. Now, there is a fine synchronization in a healthy body, there is a fine synchronization, and only one ovum is developed, becomes mature at a time. So either from the left ovary or the right ovary, only one single ovum will become mature. Now, this mature ovum, it is actually floating in the fluid inside the abdomen and somehow in a very complex manner, will not go in details of that, but then in a with a complex mechanism, this ovum, it finds its way and enters into the fallopian tube. So the mature ovum from the ovary comes out of the ovary and then it enters into this fallopian tube. And then it travels towards the uterus. So through the fallopian tube, the ovum, it will try and go towards the ovary. So from the left fallopian tube or the right fallopian tube, from wherever the ovum has been formed, it will make its way inside the fallopian tube and go towards the uterus. Now, usually the lifespan of this ovum or the survival time of this ovum is around just 1 day, around 24 hours. So, of course, there can be some differences, but then usually it is 24 hours. So now, within this 24 hours, if it comes in contact with the sperms, so if the sperms traveling from the vagina into the cervix and entering into the uterus, if it comes in contact with the male sperms, then there is fertilization of this ovum. This ovum is fertilized by the male sperms. Or we can in simple language, we can say that there is union of the male sperm and the female ovum. And then that's the first cell of the human life. It is the starting of the pregnancy. So this fertilized ovum, it will attach itself to the inside of the uterus. So roughly saying, it will attach itself into the endometrium and it will start growing inside the uterus for the next 9 months. Now, for the growth of this fertilized ovum, the first and the most important thing is nourishment, nutrition, supply of blood, supply of oxygen. So, to maintain this enough supply of oxygen, enough supply of nourishment, enough supply of blood, the endometrium or the innermost cells, innermost layer of the uterus, the blood circulation in this layer is increased, or the capillary network in this area is increased in the anticipation of pregnancy. The body prepares itself every month for pregnancy, or the uterus prepares itself to accept the fertilized ovum every month so that immediately it can give nourishment to the fertilized ovum. But as I said earlier, the fertilization of the ovum is possible only within 24 hours if it is coming in contact with the male sperm. So if it doesn't comes in contact with the male sperms, then after 24 hours, after roughly 1 day, the ovum is dead, and then the fertilization of that ovum is not possible. Or pregnancy during that month would not be possible, and the uterus has to wait, the body has to wait for the formation of next ovum, which will be formed in the next month. But the blood circulation in the endometrium, the blood circulation in the uterus, the capillary network in the uterus was increased in anticipation of pregnancy. But now this pregnancy is not possible. The ovum is not fertilized. So these blood capillaries inside the uterus, they burst open and they release the blood which comes out through the cervix into the vagina and is removed out of the body. So basically, it's the blood which comes through the capillaries inside the uterus, and then it is coming out as the menstrual blood flow. So this menstrual blood flow, it is the blood itself and also some cells, some dead cells of the endometrium. Now, all these things, they happen under the hormonal influences. We have not talked about it just not to complicate the things. But then, of course, it is all well synchronized and happening under the effects of hormones. So this bleeding through the capillaries is called as the normal menstrual blood flow, which occurs for around 4 days. Of course, it is different in different women, but then roughly on an average, it is considered to be 4 days of menstrual blood flow. Now, one thing to understand here is that this menstrual blood flow is a passive blood flow. When the blood is released from the uterus, it flows towards the cervix and towards the vagina under the influence of gravity. There is no pressure or there is no pumping of this blood to come out of the uterus, then to the cervix and into the vagina. It is just sheerly a passive blood flow towards the gravity. A common experience with most of the women, that change of position from lying down position to sitting position, or from sitting position to standing position, the blood flow changes. That's because it's a passive blood flow. So change of position can also increase or decrease this blood flow. So with this basic understanding of the menstrual blood flow or the menstrual cycle, we will move on to understand in short about the practice of yoga. Now, if we try to understand it step by step, it would be more easier. First thing is about inverted postures. Now, inverted postures, most of the books, every yoga master, every yoga guru is of the opinion that definitely inversions are to be avoided. And the reason is quite simple and the reason is quite logical. As I was just saying about it, I was just talking about it a couple of minutes back. The blood is flowing from the uterus to the cervix and to the vagina and outside the body. Now, in an inverted posture, just imagine the uterus in an upside down position. So the blood flow, which is supposed to go out of the cervix into the vagina, in that inverted posture, it will flow towards the fallopian tube. In rare situations, in rare occasions, it can even enter into the fallopian tubes. Micro droplets, not very large quantities I'm saying, but micro droplets can enter into the fallopian tube. So inverted postures are to be definitely avoided to prevent this reverse flowing of the blood towards the fallopian tube. This blood should be flowing outside through the cervix into the vagina, but then instead, in an inverted posture, it is moving towards the fallopian tube. So, to avoid this, inverted postures definitely are to be avoided. And then, furthermore, yoga talks about the direction of energy flow. During menstruation, the direction of the energy flow as far as the pelvic area is concerned is in the downward direction. So the blood comes through the cervix and vagina, comes out of the cervix and vagina. So the energy movement is in the downward side during menstruation and it helps for the blood to flow in the downward direction. But in an inverted posture, the energy movement, the energy flow will be exactly opposite, which will be preventing the menstrual blood flow from coming out, and then we are actually interfering with the energy flow. So for this reason, inverted postures are definitely to be avoided. Next is about creating pressure around the uterus. Now, when we are practicing yogic postures, we say that one of the effects of practicing yogic postures, yogasana, is it increases the blood circulation in that particular area. So, if the blood circulation in the pelvic area is increased too much by increasing the pressure around the uterus, then the possibility of more blood loss during menstruation is increased. Because in first stage, the capillaries inside the uterus, they are releasing the blood. But later on, the same capillaries, they heal themselves. They form microclots so that the blood flow is stopped. So this healing process, if you create too much of pressure from outside the uterus, around the uterus, in the pelvic area, the clot formation, the healing about the uterus would be slowed down. And there is a possibility that the blood flow or the blood loss might be increased if you do strong practices which increase the pressure within the pelvic area. So strong forward bends, strong back bends also I would say, or strong squeezing position, twisting positions are to be avoided during menstruation. So inverted postures are to be avoided and strong postures which increase the pressure around the pelvic area, around the uterus are to be avoided. So backward bends, forward bends, twisting, turning. If you avoid all these things, then the question comes up that what can be practiced during menstruation? A simple answer for that is simple relaxation technique. Relaxation during menstruation is what is expected. So, relaxing positions, there are many relaxing positions. Shavasana is one of them, okay, but then there is a flapping fish pose, many relaxing positions, pond pose, it can be practiced. So, relaxing asanas, relaxing yoga postures, and gentle stretching can be practiced. Now, gentle stretching also, it would be in some women a troublesome thing. Like if there is pain in the abdomen, pain in the lower back, or pain in the thighs, or the associated symptoms with menstruation. Some women they complain that if they do stretching exercises, the pain increases. So of course, in those situation, in those group of women, these stretches are to be avoided. But then some women they are comfortable. They say that all these associated symptoms they reduce if they practice the stretching postures, gentle stretches. So in this group of women where they are relieved of their pain with gentle stretching, definitely they have to practice these gentle stretching postures. So relaxing positions and gentle stretching positions. They are to be practiced, they can be practiced during menstruation. And of course, simple arm and leg movements, they can also be done. Gentle movements, not hard and strong yoga postures, but gentle movements of arms and legs, neck and shoulders. Definitely, they should be practiced during menstruation. And last but the most important thing, mantra chanting is recommended during menstruation. Which mantras for how long, it's a separate thing which will be discussed later on. But then definitely mantra chanting is recommended during menstruation. Meditation is recommended during menstruation. Omkar chanting is recommended during menstruation. Even Yoga Nidra, of course, it will come under relaxation, but then even Yoga Nidra practice. So mantras, Omkar chanting, meditation is recommended during menstruation. Or rather, because of the unique condition of the hormones during menstruation, it is easier to practice mantra chanting, it is easier to practice meditation. Because menstruation is a time when the mind is very sensitive because of the hormones. The mind is very sensitive, and most of the women they experience this sensitivity of the mind during menstruation. So, if the mind is very sensitive during menstruation, yoga recommends that utilize this sensitivity of the mind in a positive way and try to internalize your mind. Try to focus within yourselves. Utilize the time during menstruation for internalizing yourselves, to see inside yourselves. So the practice of meditation is recommended. So the practice of Omkar chanting is recommended. So the practice of mantra chanting is recommended. Yoga is a process of internalization, looking within yourselves. Yoga is not only about yogasana. So instead of focusing on the external aspect of yoga, like for example, yogasana practice, try to focus on the internal aspect of yoga, like meditation and mantra chanting. So focus more on internalizing, looking within yourselves during the menstruation, rather than focusing only on the yoga asana. And the last or a couple of points in the end, as far as pranayam is concerned, pranayam can also be practiced during menstruation, but then it is to be practiced without holding the breath and without practicing the locks, without practicing the uh, bandhas. So no bandha practice, no locks, and no retention of breath, no kumbhaka. And then broadly, pranayam, you can say there are cooling pranayam and heating pranayam. So the cooling pranayam can be done during menstruation. So that was in brief about normal menstrual cycle and a few yogic practices which can be done during menstruation. So for the time being, we stop here. I think most of the points related to yoga and menstruation have been covered up here. Hari Om.